Hi, everyone. My name is Danielle Gatti Palumbo, and I'm a clinical pharmacist at the Division of Rheumatology at Northwell Health. And today I'll be presenting on a journal club entitled Guselkumab Efficacy in Biologic-Naive Participants with Psoriatic Arthritis and Severe Disease Activity, a post-hoc analysis of a phase 3 study by Christopher Ricklin and colleagues. So PsA is a complex condition that has signs and symptoms of 6 main domains, including physical peripheral arthritis, axial disease, enthesitis, dactylitis, and also skin and nail disease. And oftentimes patients with psoriatic arthritis also have comorbidities, including cardiovascular, fatigue, depression, and also elevated impact on quality of life. So not only do these patients have joint symptoms of stiffness and swelling, but they also have structural damage that leads to functional limitations. So looking at these patients, there's also kind of an assessment challenge. So not only do we have the clinical assessments, but we also have patient-reported outcomes. And sometimes that may differ because patients may feel worse than they are actually presenting clinically. And those with severe disease, those that also have axial involvement, enthesitis, dactylitis, and also nail involvement, often have poor physical functions and also worse pain, greater fatigue, and also loss of work. So in the DISCOVER-2 trial, this was a phase 3 randomized control trial that studied Guselkumab and its efficacy in patients with PsA that were biologic-naive versus placebo through 6 months up to 2 years. And in a post-hoc analysis, they showed that there was efficacy up to 2 years in patients with severe psoriatic arthritis disease, regardless of baseline characteristics. However, in this study, they wanted to further evaluate the efficacy specifically in patients with severe psoriatic arthritis because that was not really clearly defined. So in this study, researchers selected 3 specific cohort definitions for severe PsA and evaluated the responses for Guselkumab through those 2 years. Patients included in the study had to have active psoriatic arthritis, so they had to have more than 5 swollen joints, more than 5 tender joints, and high CRPs of greater than 0.6 milligrams per deciliter, and they also had to be biologic-naive. They were randomized either to a 1:1:1, so Guselkumab 100 milligrams every 4 weeks, Guselkumab 100 milligrams at week 0, 4, and then every 8 weeks, or placebo with a crossover to every 4-week dosing at week 24. The baseline characteristics were analyzed using the 2-sample t-test for continuous variables and chi-square test for categorical variables. And then the least square mean or LSM changes from baseline were estimated for each of those treatment groups with mixed models for repeated measures. So for this study specifically, there were 3 non-mutually exclusive cohorts that they defined for severe disease. The first one looking more so at joint involvement and joint disease. So that was used with a measure of the CDAPSA, or Disease Activity in Psoriatic Arthritis score. So this focused mostly on joint symptoms. If you had a higher score, that meant worse disease. They also looked at low disease activity or remission in that cohort, measuring the LDA and REM. The second cohort looked more so at an overall PsA picture, and this was using the PsA criteria, or the Psoriatic Arthritis Disease Activity Score. So this took into account tender and swollen joints, as well as patient global assessment and physician assessment. Higher score, worse the activity. And then within this cohort, they also looked at low disease activity and very low disease activity scores with VLDL and LDA. The third cohort was mostly focused on patient-reported overall outcomes, and this used the PTGA, or Patient Global Assessment, arthritis and skin scoring. So all 3 of these cohorts, 739 patients, were enrolled in the DISCOVER-2 trial. Now, looking at these 3 cohorts, they then took those patients and separated them into whoever met the criteria for those 3 cohorts. 88% had met the criteria for the severe CDAPSA. 86% had met the criteria for the second cohort, the PsA, and then 29% met the criteria for the patient PTGA cohort. Although there's only 29% in the PTGA cohort, the baseline characteristics were pretty much similar amongst all of the patients, including age, race, CRP, swollen tender joint count. Except in the severe CDAPSA and PsA cohorts, those the patients that were enrolled in the every 4-week dosing ended up being tended to be more males with dactylitis compared to placebo. So in the patients with the PTGA cohort, those patients, because there were more patient reported outcomes, those patients ended up having more severe disease. They had more skin disease, more higher PsA, they had higher fatigue and pain, but they had less clinically lower CRP in the Guselkumab groups. So a total of 209 patients had met inclusion for all 3 of these cohorts, meaning that they met criteria for including in one and the other and the other. There was not many patients that were actually only included into one of those cohorts. And no patient in the PTGA cohort were solely in the PTGA cohort. And that's important because if a patient perceives their disease as active, as severe, they are actually having that clinical assessment as showing that they have severe disease. So that is important to note. So in looking at the results of these cohorts, focusing on joint pain with the severe DAPSA, so the early improvement was seen in joint symptoms as early as week 2, with greater LSM changes from baseline with Guselkumab every 4-week dosing versus placebo. And the improvements in both of the Guselkumab groups were seen through week 24 up until week 100 in 69% of those in the every 4-week dosing and 74% in those in the every 8-week dosing. And that was maintained at week 100. So definitely a more improvement in the every 8-week dosing. Also with that cohort, they looked at low disease activity, and they found that those that were in the Guselkumab group were 3 times more likely to achieve low disease activity, with 82% in the every 4-week dosing versus 81% in the every 8-week dosing. The second cohort, looking at overall PsA activity with the PsA score, they found that there was early improvement by week 8 with greater LSM changes from baseline in both of the Guselkumab groups. So showing that there was improvement through week 24 and up until week 100 in 52% improvement in the every 4-week dosing versus 54% in the every 8-week dosing, maintained up until those 2 years. So what they also found looking at the overall PsA activity is that by week 24, 20% in the every 4-week dosing and 27% in the every 8-week dosing had achieved low disease activity versus only 7% in the placebo. So really improving overall disease activity and seeing that as early as 8 weeks and then maintaining that in both of those cohorts by week 100 is really important, especially for severe patients. And they also found that 79% of those in the overall PsA activity scoring that actually responded by week 24 maintained that response. So really sustaining those high levels of response. The third cohort, looking at severe PTGA or patient-reported measures for overall disease activity, they also found that there was early improvement by week 8 with greater LSM changes from baseline in also, again, both Guselkumab groups versus placebo. And that was seen as 64% every 4-week dosing versus 63% in every 8-week dosing by week 100. So again, very similar responses in both of those groups. Some limitations of this study was that there was no consensus definition on what is severe PsA, right? So in this study, they defined 3 cohorts to identify those definitions. They also found that there was less patients in the severe PTGA cohort, the patient-reported outcomes, and that's due to more stringent scoring. But the good thing is that those patients also were included in one of the clinical scoring other cohorts. So majority of them were also included in there. Some other strengths was that there was low discontinuation rates and also conservative handling of missing data. And then with this study, they also used a validated composite cutoffs with their data. So overall, this study was pretty interesting because they used those 3 cohorts for physician and patient assessments to identify those patients that we really don't have true definitions for severe PsA, and looked at those results specifically for severe PsA patients over 2 years. And what they found is that joint symptoms responded by week 2, and overall symptoms and disease activity responded as early as week 8, with greater improvements by week 24 and sustaining that response by week 100. So overall, Guselkumab produced it earlier a rapid or robust improvements that were both durable improvements versus placebo. They had higher rates of achieving and maintaining that low disease activity through 2 years, especially in our severe patients. So that improvement is pretty impressive in my sense. In the efficacy of Guselkumab with the different dosing, the efficacy of every 8 weeks was very similar to every 4-week dosing. So that's also something to consider in patients with severe disease. Maybe the every 8-week dosing is sufficient for these patients. And then this also better supports basically the starting biologics early, and also first-line use of Guselkumab was associated with low disease activity. So further supporting the use of Guselkumab as first-line therapy. So overall, I think this is a great study. It shows definitely in patients with severe psoriatic arthritis, robust improvements with Guselkumab. So I think this is a great option for our patients, especially in severe disease. For any further information on any other topics, please visit our RAP.org website and visit our content room, and also our RAP ACE app. Thank you.